that balances out the quantitative methodology. So our next speaker, as he's getting set up, I'll introduce him. His name is Ray. He asked me to call him that. So Ray is
my last name's German.
Ray is aspiring to pursue his PhD in clinical psychology, so he's coming over to the dark side. He has worked with the Syrian refugees and Jordanian aid workers to provide capacity building and community-based trauma support. So let's give him a round of applause.
Hi everyone. I'm trying to find the presenter view really quick.
The button, the big one.
Huh?
The big screen. The lower right.
Lower right, keep going.
Yes. Yes.
Yeah, I'm trying to find the presenter view.
With the notes.
With my notes.
Yeah.
Oh my goodness. Okay.
Next time.
Yeah. Let's.
Yeah, that would help, but a lot of people do Macs now, so.
Yeah. Let me see. No, it's not working. Okay. I will do my best.
That's okay.
Good afternoon. First, thank you all for having me here. It's quite an honor, and I'm very excited to share some of the work I have been a part of. My project is on perceptions of substance use in Jordan. I'll try and jump right through it. This research came out of a trip to Jordan that I took with my psychology professor at the end of 2013. We were traveling there under humanitarian intentions to work with Syrian refugees and Jordanian aid workers. We worked in northern Jordan in these three locations, and we were there doing disaster and trauma resiliency training. As you saw at the beginning, this talk is not on disaster and trauma resiliency, it's on perceptions of substance use. So we'll get to that in just a minute. But I traveled with a nonprofit called the Health Support Team. And the Health Support Team works through capacity building. So they've worked in Haiti after the earthquakes in 2010, and our work in Jordan was the first time that we were using the curriculum in more of a man-made disaster setting. So the two tenets that really make up the Health Support Team are that we do, through curriculum, capacity building. So we really want to increase the amount of mental health resources in a community by training local non-professionals to be resources for their community members. And then after the first round of training has taken place, we definitely try to return to that place and teach the people who we've instructed during the first round to be instructors for the next round of community members. And when you adopt this style, it lets things get taught in the correct language, cultural nuances get added in, and then it's not us from the United States coming and teaching whoever we are with, it is your community members teaching your community members. So the inspiration for this project came from the first visit, when, as we do in the curriculum, we mention things like substance use, because that's very common after a disaster. And our immediate response that we witnessed was, that's not a problem here, that's not something that our community deals with, that's not something that we need your help with. And then very quickly after that, there's the, well actually, or there was this one time, or, so we got the sense that there was a lot right below the surface. And another conversation that we heard a lot was that there's a growing market of hookah and shisha in Jordan, in Amman, and all over. And so those were two conversations that we heard a lot of. So in between our first and second trip, we decided to come up with some questions so that during our second trip, we'd be able to gather information and hopefully add to the literature. I want to acknowledge that I'm the last person who's qualified to talk to you all about some of the tenets in Islam regarding prohibited substances and substance use. Like Kamar is not something I know a lot about. However, in some of our background research, we did notice that there's room for gray area, as we just heard about in the previous talk, and that of education about substance use leads many Jordanian adolescents to not get proper education around these sorts of things. So our study was also qualitative. We used narrative analysis through interviews that we gathered from 6 participants. And those interviews were guided, semi-structured interviews that were led through a series of questions regarding perceptions. How do you see how does your family respond to substance use? What are your thoughts when you think of substance use in your community? Again, narrative analysis. I'll show you the process of narrative analysis. After our interviews, our team did multiple readings, and we paid careful attention to the overall narrative thread. And from there, we broke down our transcripts into meaningful segments and complete thoughts. And from those segments, we tried to categorize those thoughts into themes, categories, and concepts. So this is a screenshot of one of our pages of analysis. As you can see in the middle, here's the fragment. Here would be the theme that we pulled out of it. Here's the category that it fell into. And here's maybe the overall concept. And so this was applied to all of our interviews. We had 6 participants, 2 male and 4 female participants, mainly from 2 different generations, or that's how it felt during our interview process. And so now we're going to get to the good stuff, it's the findings. Out of the semi-structured interview, our results kind of fell into 4 categories with subcategories. Our participants talked about substance use from an Islamic understanding. They talked a lot about the prevalence of substance use, how they and others respond to substance use in Jordan, and there was some discussion around recovery resources. So over the next set of slides, I did my best because I think the most interesting part of our research was what was said. So you'll hopefully, I tried to put as many actual quotes from our participants up there as I could. And those quotes are really emblematic of the things we said. Unfortunately, we don't have the notes, so I'll do my best to remember what each quote represents. But the first thing is that immediately our participants said emphatically that substance use is forbidden. That was just the first thing that happened as soon as our interview started. But soon after that, there was acknowledgement of the gray areas, such as Sharia law, and one participant stated that she doesn't put too much stock in it because it's more people's interpretation. She uses like her moral compass in other ways instead of things like that. Another component of the gray area is that alcohol is legally sold and consumed in Jordan by non-Muslims. So that creates a dynamic of availability despite illegality. So in the category of prevalence of substance use, we saw a lot of interesting quotes. One thing that was very interesting was the range within which people reported. So we had everything from 10% to 70% of the population use substances. The other 2 main mediating factors that we noticed were geographic location and gender. So definitely rural versus urban tended to be a theme that we heard from our participants, where alcohol consumption in larger cities was much more common, and it was much more likely to have occurred with males in the population, not just in our sample, but in our population. So to jump ahead, we're gonna get to some of the better quotes if we can. So one of the things around prevalence, I'm sorry everyone, is things around access and prevalence, is there was a concern, this is specifically with hookah, that the young people are getting a lot more access to it, and that it's being marketed to younger people because of flavors or colors or things like that. And this is one of the places where we noticed a gender difference, is that hookah smoking was much more accepted for women, and it was more readily available and less stigmatized for women to partake in smoking in restaurants. Cannabis was also discussed as available and accessible, but much less so than alcohol. This is a whole narrative that we had regarding pills and inhalants, and I think it's really interesting and emblematic of the sort of, this was a very small piece of an interview because we kept returning to alcohol, and so one of the themes that we picked up on was that although there may be more dangerous and other substances that are being used, they're not regarded as such. So this is the only, one of the only mentions of pills and inhalants that we came across. And another theme was just like we said right below the surface, there is a theme that it's not in my family or not in my community. And even though we were assured of that by our interviewees, very soon in the conversation, there was a personal connection made. So this is a quote from one of our participants who had explained that she doesn't know anyone in her family who associates or partakes in substance use, but then she goes on to tell us a story about her sister and morphine use. I want to be respectful of time, and we'll jump to response to substance users. So this is how people in the community view people who use substance, just to clarify. So one thing is that it can greatly impact your reputation. Participants describe people who drink as weak, despised, selfish, untrustworthy. There's a story of someone who was found out that they had consumed alcohol and they were fired from their job by one of our interviewees who runs a business. There was also a difference in if you saw substance use out there versus within your family. Within your family, it was something you hid or handled in as quietly as a way you could. But if substance use was handled in public, it was often handled aggressively and confronted in big ways. Substance use, we're going to jump ahead, was also very much mediated by gender and the response to substance use. There was a lot more leeway for men to consume alcohol or be involved with substance use than there was for women. Even though this second quote talks about shame and what difficulty it would be in a rural setting for a young man to be seen having consumed alcohol, you'll hear from one of our participants how often young men are forgiven for these sorts of things. So this is a little bit more towards the rural versus urban. It was reported that in cities, there was much more of a, we'll just call the police, like, we'll let the police take care of it, it's illegal. Where in towns, people would actively engage with someone, maybe even fight them if they saw them consuming alcohol. So, don't have too much time, but I definitely want to play you all a little clip from one of the interviews as the last.
More than finish.
Are there differences in how people would look at you or treat you if you're a man using some kind of drugs versus a woman using drugs?
Of course.
What would that be
In
different?
our culture, of course. لما تكوني انت if you're a girl, it's more discrimination or stigma than the man. The man, he is
Can do anything he
teenager.
wants.
He
We can forgive him. It doesn't matter because he's a teenager. He can do whatever he wants. He wants to
for the
to
girl,
express
it's all
himself.
life.
And
That's it.
No.
She's
I'm out of time. I'd love to talk to you more about some of the other results. Sorry for the extended presentation. The last thing I'll close with that was a big theme for all of us was that even though these things are just beneath the surface and there is a little bit of acknowledgement that it's happening, there's still a gap between that acknowledgement under the surface and engagement in problem solving or addiction or substance use. And that gap is mediated by taboo and stigma and allows these sorts of problems to be perpetuated. That was a common theme that we heard from our interviewers. Thank you very much.